Anytime now. Here we go. Recording has started. Do you see that?
Yeah.
Perfect. Cool. All right. I'll just get that out the way. So recording has started. Okay. Let's move that. Hi, everyone. Welcome to Community Builders Show. My name's Nurse Phill, founder of Support Worker Hub, and we really love having you on every week, learning new things to build capacity for your clients and also community access. What things can we do out there to help our clients and get them more involved? Well, today I was trolling through Instagram a little while ago, and what I'm going to show you today just popped out at me. It was like, oh my God, this is a must-have. Everyone needs to get it. So I chased down the person and got her on today. So I want to welcome Lou from My Medical Folder. So welcome, Lou. We chased you down. We got you. We tracked you.
Did. Yes,
and
we did.
Really, I don't want to spoil it for everyone, but could you tell them what I was so excited about and what you do?
Yeah. Thanks, Phill. Thanks very much for having me. As you said, you were trolling through your Instagram and we did pop up and you reached out to us, and I'm very grateful for that, because this folder is something that I'm extremely passionate about. And as you said, it popped out at you. This idea just popped into my head. And how it came about was my sister was diagnosed with stage 4 terminal cancer, and we were just consumed with paperwork, documents, doctor's appointments, reports, everything just kept coming at me, and I was just totally overwhelmed. And I started to collate just an A4 folder and pop everything into it. And then you get those moments at 2 o'clock in the morning where you think, this may have legs and this could possibly help other people. So I set about to play with my own folder and dissect everything into compartments, so to speak. And when I started to do that, I realised how much easier it was to navigate through the folder and find certain reports or what appointments we had coming up. It was just there, it was easy. I wasn't overwhelmed by everything at that point in time because of the way I had set the folder up. I spoke to my son, who was a paramedic, and I gave him my vision, and he said, Mum, he said, this is something that we're faced with every day. We go to people's houses and we ask, do you know what medication your loved one's on? They've got no idea. So he could see the value in the folder, and together we sat down and we started to make some notes. And it was important for me that the folder was easy to navigate, not just for the person who owned the folder, but also for their carers, their loved ones, hospital staff, and also first responders. Anyone could pick the folder up and start to look through it and see exactly what was going on with this person.
And and that's exactly what popped out to me.
Yeah.
What you exactly said. And I saw your post, and I must say, everyone, look at this. I've got my own very own copy. So thank you so much. It's beautiful. It's and it is easy to use. We'll go through a bit of it today, but yeah, anyone over the age of 18, you've got a medical history, get one of these and start filling it in and keeping it, because it will last your lifetime, and it will give us, working in emergency, we see people like your son did every day coming in. They don't even know all the medications on. They don't know the doses. They don't give you all the past history that they have because they don't think it's relevant. And you're like, oh, I'll give you an example. I had a chap a few weeks ago, had facial droop, and bit dizzy. He said, bit dizzy. And I said, what's your medical history? Oh, I've just had a couple of hip operations, nothing major. And you're like, okay. But he looked like something else was going wrong. So you've got to question. And so that's costing time. It's costing, what am I looking for? I'm still having to search because what you're presenting isn't what you're saying. It's too different. And then, oh, by the way, I'm diabetic. I'm like, hello, hello, we've got diabetes. But if I had the folder, if
It's
I
all
had your
there.
folder and I
Mm.
opened up is what's your medical history, I'll know straight away diabetes.
Yeah.
I'll go facial droop, dizziness.
Yeah.
Are we having a stroke here?
Yeah.
What are we doing?
Yeah. Yeah.
You know,
And you've got,
and that's what pumped it for me, Lou.
yeah,
Really
and
did.
you've got your family medical history too, which is quite relevant to what could be happening. And these
Yes.
are all things that, you know, our medics and our hospital staff need to be aware of, that could break down the time that is needed to actually get the right medical attention that the person's need, you know, is basically needing.
Yes.
But, you know, trying to manage a folder with a lot of paperwork isn't the way to use the folder. It's meant to be kept up to date and relevant, but we've got our past medical history there that we can also look back on. We've got our legal section there as well, so that if your loved one has an enduring guardianship or, you know, advanced care directive, we've got everything in the folder that is needed. We've got community care for, you know, people that have a lot of external services that come in. We've got everything there listed.
And
That
that's what I
need.
loved about this. You exactly what you've put here. It's exactly. It's like I can go to any part of this folder and find the exact services. Like you're right with legal, people go, "Oh, I've got an advanced health directive, or I've got enduring power of attorney to someone," and I go, "Well, where is it?" Unless we see it, we can't act on anything different. So we need, and like you say, if we have a copy of it, that's what we need.
Yeah, it's all very relevant. People don't think it's relevant, but it is relevant, and it does save time, and it does take the stress out of managing your health concerns.
Yes.
We work a lot with NDIS providers as well. We're able to send out invoices to NDIS plan managers, or even if you're self-funded, we can also help out there as well.
Yeah, it's just it really does cover anyone, doesn't it, that
Does,
has a
yeah.
health history. And like with NDIS, and there's a lot of people in NDIS that watch this show, is if your clients are non-verbal and like the support workers taking them to the hospital and they don't know the full history, because we get that all the time. At least if we've got this folder, you know, we've got the My Aged Care My Medical folder here.
Yeah.
We got that. At least I can go through that. When, you know, you can give that to the health team or the medical team, and they can look through that and get a better picture.
Absolutely. Yeah, absolutely. I'll give you an example of how well the folder did actually work for myself. I'm also a carer for my mum. She's 85, and she had a heart attack in February, March, and prior to that, her heart attack that she had in November, we were actually had a copy of her ECG in the folder. Well, the paramedics on the day said, "You wouldn't by chance have that copy of the ECG?" Well, yes, we did. It was in the folder. So, you know, things like this are extremely relevant. People think, yes, but will they take notice of the folder? They will take notice of the folder. I mean, it's professionally put together. It's very identifiable with the logo on the front. So if this is sitting on your coffee table and a USB is sitting on the coffee table with all your medical history in it, I know which one they pick up before they pick the, you know, the USB up. So it's all sort of tailored so that it's identifiable to anyone who may need to access it in the event that you're not able to communicate also yourself.
Exactly.
And easy to pick up and read.
And to your point, like the paramedics asking for a previous ECG of your mum, that can be the difference between life and death.
Definitely.
Like it really is. It's like, what is different about that ECG before to what mum's is now? And we have people come in and no previous history, but we'll have an ECG change and we go, well, is that a new thing or is that an old thing? We don't know.
That's
You know,
right.
But if I know, we go, oh, that was there before, so this isn't a new thing, but what else is changing?
That's
Or
right.
it wasn't there before. Oh my God, this could be life-threatening. We need to act fast.
Fast, yeah.
And like you say, no one's looking at a USB. You got to plug it into something. We're on the go. A folder that's as easy as this, that you can just flip open and go, right, I need that section. I need the next DCG. Where is it? Bang, got it, done.
Yeah.
Love it.
Yeah.
Yes. Yeah.
It's certainly it's made life easier for us, and the number of folders now that I'm getting out into the community and the feedback, they don't always leave messages or reviews on the page, but they'll send me a personal note to say how much of a difference that the folder has made. And I know from personal experience using the folder ourselves that the benefit of it is a must. And you know, our aging loved ones, they forget they love their independence. And this is a way of them keeping their independence to a degree as well,
Yes.
because it's something that, you know, is very tangible to them, but it's also something that's got a lot of relevant information in there that, you know, can help others in the event that they can't actually advocate for themselves. Yeah.
Exactly right. And as we all are aging, seeing that history and having it all together, because, you know, when you're getting into your 70s and 80s, you might remember all the things that happened to you, but they could be relevant to that presentation when you're in a health crisis and you're in emergency, or even when you're going to your physio or osteopath or podiatrist, you know, to like if a podiatrist could open the book and go, oh, you're a diabetic. Oh, we know we've got to do certain things differently because of your diabetes. It's there. They know it. They've got it straight away.
They've got
Very
it.
important.
They've got it. Another key factor that we decided when we were putting together the folder was the observation chart.
Yes. What I'm going to ask you, what made you go for the observation chart?
Observation chart was in particular with mum's heart attack. We'd call for the ambulance, and with this in this particular instance, I was actually able to just write briefly a note of mum's symptoms, her appearance. I did take a temperature, and we've got a heart monitor here as well. So I was actually able to write down the steps that we had taken while we were waiting for paramedics to come. Like, we administered the spray under the tongue, and all of this was relevant. And it was like a handover actually to the staff, like to the paramedics when they got here. They could just see it as a glance and just see what had been taken and done in that instance.
Yes.
You know, and again, they said, would you mind if we took this with us? So that was pretty well much the idea behind the observation chart. Because in the heat of the moment, you do tend to forget. You know, you sort of like, sometimes now you can say, you know, what was your blood pressure half an hour ago, Lou? Yep, 120 over, and you forget. So, you know, in the heat of the moment, things like this are relevant. So, you know, jot it down.
Yes, and that's what I like. And it's not just you've got like blood pressure. Not everyone has a blood pressure machine, but everyone can do a heart rate. Everyone can say how someone's looking, you know. And if you are diabetic, you know, you can put, it's really important that we know your blood glucose level. So putting that there, and then a few notes and the date and time it happened, because what I say to a lot of people is they come in and go, oh, Nurse Phill, I feel like a fraud. I've come into hospital and there's nothing wrong with me now. But it's like, there was something wrong with you at home to make you come
to hospital.
What was that? Because, you know, if we can find out what it was, we can help more and treat it better.
Definitely.
And it gives us a base, especially temperatures.
Yes.
When doing temperatures, you might have got a temperature at home, had some medication to bring down the temperature, come in and go, oh, you got no temperature now, you're all right. And you're like, as the person, you're like, no, but I was crook. I had a big temperature. I was sweaty. I was this. So it makes us look for other things.
Yeah.
As well.
Yeah, no, it's it was good on, it worked on the day. I was keen to, well, not that it was good that I was actually filling it out for my own mother, but it was nice to actually, for me to use it personally and know that it actually did work.
Yes.
So yeah, so
You road tested. You
I
road tested it.
yeah, I did road test it on my own mother.
Yes.
I'll try not to do that again.
Yes.
The other component was our appointment chart. Because of my sister's diagnosis, it's actually affected her brain to a degree. So she does have trouble remembering. So with the appointment charts, we've made this again quite simple, but we've got the doctor's name and obviously their address and their details. But if there's any preparation required, so she often gets confused between the MRIs and the PET scans. So with a
Yes.
PET scan, you need to fast and so forth, but with the MRI, you don't. So for it to be written down on this particular appointment chart that there's no preparation required, again, just takes the anxiety out of, has she done the right preparation for this test, so that when we get there, we're not told, I'm sorry, we can't do the test because she should have fasted for this. And then also too, if you need a referral for your next appointment, sometimes you'll walk out of an appointment and that's your 12-month referral gone.
Yeah.
It's on the appointment chart for your next appointment that you need to go to with this particular specialist, that we need a referral. So it's just a prompt to get in touch with your GP to update that referral. So I've tried to make the folder as user-friendly and take the thought process out of everything for everybody, just to make their life a little bit easier, because as carers support people, it's a tough gig, and
Yeah.
you know, it's sometimes hard to remember everything yourself. So it's just something that I have found is it does definitely takes the stress factor out of it for me.
It's beautifully laid out. I love it. Can I ask you why you put questions there?
Questions to ask. Sometimes we'll walk out of a doctor's appointment and we'll say, should have asked that, I meant to ask that. Write your questions down. It's, you know, it's no shame in writing down and, you know, trying to get the most out of your appointment. In many cases, you know, we're waiting 12 months sometimes to see a specialist. You know, you don't want to waste the time when you're in there. You want to be able to maximise that time and get as much out of the appointment as you possibly can. And, you know, questions, there's always a lot of questions that you want to ask.
Yes, and that's right, exactly right. Or, you know, your appointment might be 2 or 3 months away from you, and you'll have a question from 2 or 3 months ago and then forget about it by the time you get there.
Definitely.
But now you don't have to worry. Just write it down. It's done. It's done. Put it there. Bang. It's and it's like, and this is why I jumped at it when I saw your post and I saw my medical folder pop up. I'm like, this will just help people's lives so much with their health care and the way they look after themselves. And it'll probably help decrease the amount of times they come into hospital.
Oh, definitely.
Because we get it all done straight away. And and what it like probably with your sister, she had more than one specialist. Right. So they never talk to each other. One thing we know is that, you know, it's very hard for them to communicate, and they might get one letter and all that stuff. But at least when you got one folder, everyone can be on the same page. Everyone can read the same thing and do what they need to. So
yes, it's certainly it's been a game changer for us. And you know, I've tried to make the folder as affordable for everybody. I'm not out to make millions. I'm out to make life easier for so many people, because as a full-time carer, you know, we can't do our job if our cup's empty, and we need to function, and sometimes we get overwhelmed by everything that's going on. And I just feel so passionate about this folder that, you know, it's just so important that we can reach as many people as possible that need it, just to make their lives easier, you know. And it'll be an evolving folder, because now my brain just doesn't stop.
Yes.
It's, you know, at the moment I am working with a oncology practitioner, and we will be putting together a folder for cancer specific.
Yeah, right.
So,
yeah.
you know, it's definitely a project that's dear to my heart, through circumstances, sadly, but it's a project that I know will help other people, more importantly as well.
No, that's right. And like you say, with the cancer specific ones, it's like when people with the oncology patients come into emergency, it's like even knowing what sort of portacath they have. So
Exactly.
it's a access device that goes under the skin and in the blood vessel, and that's where all the medication blood tests can come from for people. And there's different types. So if we knew up front what sort they had, and we knew which needle to put in, saves a lot of time and trouble.
Definitely, you know, and as far as the chemotherapy as well, there's numerous types of chemotherapy. Just to know exactly what treatment you're on, that will all be listed in the folder. So yeah,
Yes,
that's a little
that's good.
project that we're working on at the moment.
That's
So
brilliant. And
yeah,
even how to care for, like, because we've got a lot of support workers that look after people, and they do have chemo at home. And like you say, you could even have a section in there on how to handle the chemotherapy hazards at home, like flushing toilets, what happens if they vomit, you know, all that
that's
sort of
right.
thing.
Yes.
So that's all related to making sure that you're healthy as well as the client you're looking after.
That's right. Because I mean, it's uncharted waters for carers, isn't it? You know,
Yes.
and there are precautions that need to be taken, that I certainly wasn't aware of. You know, I thought the patient went in and had their chemotherapy and they came on home. But you know, if you do have a vomit, and you know, there's precautions that need to be taken, because this drug is potent. So you know, very unaware of it at the beginning of our journey, but it's all relevant. So yeah, that's our little project that we're working on at the moment. So hopefully towards the end of the year, that one will also be launched.
Well
So,
done. I look
yeah,
forward to seeing that. Can
yeah.
I ask, like, what I loved about, like, you really have thought of everything to try and help take the pressure off people, because when your health is under stress, you're not thinking clear. It's really hard to get everything right. And I really loved your top six,
Tips.
the top 6 tips. How did you come about the top 6 tips?
This is how I use my folder. This is pretty much how I use my folder. So particularly with the medications, because your medications can change. So to use a pencil. So rather than, because I'm a little bit OCD as well, so to have a messy page just does my head in.
Yes.
So use a pencil and then just rub it out and just update any medications that you know, have changed. So basically this is pretty much how I use my folder, and I just thought, well, you know, it might just help others to take the thought process out of trying to figure out the best way to maximise, like the little A5 pouches that I pop my observation charts in and the appointment charts. I just pop a little hole punch in the back of those in that, and it's now placed in the back of our folder here. So everything's easily accessible. So it's all in the folder. You don't have to go looking for it.
And
the
I like
monthly.
we tell them where to buy it from too, you know.
Yes, yeah, definitely. So just to keep the because I mean the actual divider pages are a hard card, but the page inserts, like your little personal detail pages and that, they're A4 papers, but they've all been commercially printed. But to use your little ring binders to sort of pop onto your whole area, just so that you don't tear your pages, things like that. Just they're little simple tips, but it's again the best way that I've maximised using our folder. Like your immunisation page, just print out from your MyGov account, just your immunisations to keep that in the folder and up to date and relevant as well.
With
What else do we do?
tetanus, especially,
Tetanus,
like,
yeah,
because if you cut yourself, like you're cooking or something, and you cut yourself, or in your garden you hurt yourself,
yeah,
one of the first questions we ask is, what's your immunisation status and how long since you've had your tetanus injection?
yeah.
And people go, oh, I don't know, oh, I can't remember, which is fair enough, because some people do take ages, and 10 years is a long time.
Mm-hmm.
So having it in the book and going, right, we had it in 2017. You go, oh, well, if you've got a dirty wound, we might have to, we'll get the doctor to check on it. But it's something we can flag with the doctor. But if you've had it in the last 6 months, we can go to the doctor. Oh, we had it in February this year, So they can make a more informed decision and go, yep, we know exactly when that immunisation was done.
Definitely.
Love
We've
it.
got the little 12-month calendars as well.
I know.
That's your
love
fridge
this.
magnet. That one's your fridge magnet.
Yes.
Yeah, but we've got the little 12-month ones. That one there, I usually just pop inside the front cover of our folder.
Yes.
Yep. So I usually just your little clear sticky tabs you can get from Officeworks, just inside the front cover of the folder, and that's just a snapshot for you personally, I guess. But then you do have your little fridge magnet.
Yes, because I like that. That was really good.
Yeah.
So you know exactly what your appointments are and what you need to do.
And the whole family, you're all on the same page. Everyone in the family knows exactly what's going on. Yeah. So
and you've kept good communication there. You've kept good flow of communication for everyone.
That's right. So, but I think too, just maybe set yourself a day. Try and set yourself a day, a week for you as a carer. I think that's really important. So, no,
that is true.
I've tried to make it as simple and easy flowing as I possibly could, to take the stress and strain out of somebody else having to think about putting something together. Anyone can put together a folder that works for them, but the purpose of me putting this folder together is so that people don't have to think about doing it. And I've tried to cover as much relevant information as possible, not just for, as I said, the individual, but for carers, other family members, paramedics, hospital staff.
Even like your healthcare appointments, or even going to the pharmacist, like take them to the pharmacist, because pharmacists can issue certain medications. If they actually know your history, they can have a look through and get a better idea of what's going on, which is the whole point,
Yeah, definitely.
It's open and clear information.
Yeah. And I like putting together the folder, as I said, my son being a paramedic, but I've also, I have some great nurse friends as well who have got the knowledge also. But I did, taking the folder up to our local pharmacist as well for his input, about what information do we need to include in the folder, but again wanting to make it as simple, uncomplicated. I can't do complicated. It needs to be simple and easy to navigate and to understand.
Yeah, and that's the big thing, because there's so much going on in life, and and having this ready to go is really important. Really
Yeah,
important.
I
Have you
agree.
gone to people in aged care and places like that?
Oh, look, I'm hoping in the coming months I will have a lot more time on my hands to be able to navigate and get through. I'm actually attending the Care Expo in Darling Harbour. I think it's the 10th and the 11th of November. So I've actually got a stand down there. So it'll be great to be able to network also with other providers and businesses at that particular expo, but also then to connect with people coming through and just seeing what we do have available. So the plan is to start to get out and on the road and do a little bit of repping and connecting with the community. I'm wanting to start a community notice board on my website where people can register their organisation, particularly like support groups.
Yeah.
So wanting to have a register of certain support groups that perhaps people, if they're unsure of where to go, can connect and we can steer them in the right direction.
That's brilliant.
Yeah, really
Yes.
really big on community and connecting people with the help that they can access. There's a lot of help out there, but there's also a lot of confusion
Yes.
for
Yep.
where do you go. So I'm all about trying to help and just make life easy.
Get them. Yeah. No, and it really does make life easier, and it's very structured, and you cover like, and if people go, oh, what do I do? Is just go back to the main page and just ask yourself the questions for each of those topics, like legal or community care or diet or immunisations, your medical reports, and then it will slowly build up. Like it won't be all of a sudden you've got to put all these years together at once. It's like, let's start with the most recent stuff. Your most recent GP letter is a good place
Yes,
to start. Get that up, and then work back from there. And as you
definitely.
fill it out.
Definitely. How I work my sister's folder is that I have her original diagnosis in the folder, and I have her original report, MRI, PET scan, and then I now keep the relevant two. So her last two MRIs and last two PET scans, it's in the folder. So the next time we have a PET scan or an MRI, I swap it out and then I archive. So I have a
Yeah,
folder that I archive in and a folder that is current and relevant, but it has also the initial diagnosis of the cancer.
that's
Yeah.
very good. That's very good. Make it come back, and so you
Yeah.
can always go back to the original and
Mm,
see what they start with.
mm,
So
yeah.
brilliant. That is very good. Is there anything else we need to know?
No, I'm open to suggestions by any of our NDIS people out there. I'm always open to suggestions on ways that I might be able to improve the folder. I see this as a community folder, not just a folder that I've put together. So if anyone has any suggestions or feel like they would like to see something else in the folder, just send me a message
Yeah.
and I'll certainly follow it up. And if it's doable, I'll do it if it's
Mm.
doable.
Well, you've done all this, so we
Yeah,
know it will
yeah.
happen.
It was 12 months in the making, and I feel confident with the direction that the folder's going. I feel like it is on the right path, and the decisions that we've come to this far have been good decisions. So we'll keep tracking and. Yeah, any suggestions, any input from anybody out there, I'm more than open to receiving that. Yeah,
Yes. No,
yeah,
brilliant. Really,
yeah.
really brilliant. Yeah, because like I was very lucky, everyone. I was very lucky. I got my beautiful box and package today. So, and I just opened it up and it was just easy. You were right. It was just easy to use. I could easily put it together. It's got all the parts in it that I'm thinking about, and like everything that, like the obs chart, I'm like, of course this is awesome, because you know, how many times do they come in and like the ambulance drops them off, and you know, they had a temperature at home and not at hospital, and it's like, yeah, exactly, I need that. Or you know, going to the medical your appointments and forgetting about the questions to ask, so now you can write them down. It's just, they don't have to think. You've got all the memory pegs there for them, so they can remember it all.
Yeah, we've got so my sister does have an advanced care directive order, so we actually included down the bottom of the folder an area where you can actually place, I don't know if you can see that.
Oh,
there's a little sticker that comes with each folder. So if you do happen to have an advanced care directive order, the sticker goes there, so then you know, the paramedics know that this is in place. But then, of course, it has to be supported by the supporting documentation in the back of the folder where the legal section is.
Yeah, exactly. Yeah, because we need to actually see it. Like, if we don't see the legal document,
yes,
we can't act on it.
That's right.
So yeah, so that's brilliant. Very good. Well, really appreciate your time today, and I'm sure
Thank
that
you.
we've like everyone in the Community Builders show really got a lot of information and ways that you can support their clients and support their loved ones, and understand now why it is so vital that you have a My Medical folder. It's not a nice to have, it's a must have. To me, it's a must have.
It is.
It's an absolute must have.
I
And
agree.
so that's why I'm really grateful for you to be on the show and talk to more people about it, because like, I'd love to see in emergency departments these blue folders in everyone's bed space.
Yeah,
You know?
it'd be lovely. My
Yeah.
son says to me, Mum, I look forward to the day where I go to someone's house and they've got a folder. And I said, that would be lovely, because then I know it's working. Yeah,
It's working. Exactly right.
definitely.
Yes. Well, thank you, Lou, for your time.
Thanks so
Really
much,
appreciate
Phill.
it.
No, I appreciate it.
Just one thing I nearly forgot. How can we buy one?
Yes, certainly. So we've got a website, so mymedicalfolder.com.au. So if you head to that, you can purchase directly. But if you are an NDIS provider and you do have a participant that wishes to purchase, just send me a message with their NDIS number, the details and so forth, and we'll send an invoice to you. So yeah, quite easy. The process is quite simple, and at the moment we've got your order, we generally have in the mail the next day.
Beautiful. Quick turnaround. It always makes it quicker.
Yeah.
Love it. Well, thank you so much, Lou, for your time. We really appreciate it. Lots of value there, lots to understand, and that My Medical folder, it is a must have for everyone, when to make sure that all your health needs are in one place, and get in contact with Lou and the team if you need to buy one, and look forward to seeing you all on the next show. So my name's Nurse Phill. Thank you for being on our show, and take care. Thanks, Lou.
Phill. Thanks, Phill. Cheers.
Bye-bye. All the best, and I wish you all good health. Take care.
Thank you so much. Bye, Phill.
Bye. Stop.